Thank you so much for being here today. This is, I know, unprecedented. A lot of us are at home, working from home and taking care of children as well as our relatives and parents. And so we really appreciate you taking the time to link in with us and be part of this conversation. I know that some of you have submitted questions, and of course we will talk about those questions later on. We do have a full program, and I just wanted to again welcome you to the Preventing Scams While Supporting the Family Caregiver Conference. And we are so honored to be collaborating with the District Attorney's Office. And they have been great, instrumental in really participating in a lot of the programs that we've had here in our communities, because they do care about the same issues that we care about and have been very supportive throughout the years. And now we have our district attorney, Summer Stephan, who's going to be joining us, as well as her staff member, Scott Pirrello. And so we're so excited to have them here. I do have a couple of things that I just want to let you know. If you are joining us for the first time, make sure that you connect with our organization as well as the district attorney's office if you or someone you know could utilize their services. I am definitely going to be sharing our contact info, and I'm sure that the people, the staff members from the district attorneys will do the same. So make sure, if you don't have already, get your piece of paper, get your pen. This will also be available later on, and we will share that through our social media and our email list. But of course, if you want to take notes, feel free to do so. All right. So right now, what I want to talk about is something that is very dear and near to my heart. I was a family caregiver. And as a family caregiver, I went through the whole range of experiences, which I think some of you might also have been experiencing, right? It's not easy. It's challenging, especially if you are working or if you have children that you're taking care of. And so kind of moving in those different directions and trying to balance and multitask is not easy. So I know that when I was a family caregiver, I thought I could figure it out. I thought I could just pick up a brochure, make a call, go on a website and learn what I could. What I wasn't prepared for was that emotional roller coaster that many caregivers find themselves on, and unwillingly on this roller coaster, because some days are good and some days are bad and some days are more challenging than others. But I think especially for our generation of caregivers, you know, the average age of a family caregiver in San Diego County is a 49-year-old female working at least 20 hours outside the home. So if you think about that, and you know, they probably are multitasking, it's not easy. It's not easy. And when I was caring for my great aunt, she was 93 when I started caring for her, and she had dementia. She would forget things, and it was not easy for me to remind her to do something as basic as wash her hands. So, you know, I say that because right now we're constantly being reminded, wash your hands, cover your face with a mask, you know, 6 feet of separation between people. And that cannot be easy if someone has memory loss. And so I wanted to bring that context into today's conversation because we are living a very unique situation. So when I was a caregiver, I found that it was necessary for me to reach out for help. And I needed to do so quickly. And I actually reached out to Southern Caregiver Resource Center because I had heard that they had all these programs and understood what I was going through. And so I did, and I found it very helpful. And it's, I know it's not easy to ask for help. A lot of caregivers sometimes feel that they can do it all, that they are, you know, the ones responsible, and so therefore no one else can take on this task. You know, talking to caregivers on a regular basis, I hear stories from, you know, I know how he likes his coffee, and I can't have my brother do it because he's going to burn the coffee. So forget it. I'm going to have to do the coffee. And so we kind of put that on ourselves, right? This added pressure to be the best and to be perfect. But with those pressures come stress, And with stress, sometimes we get aggravated, and sometimes we feel angry. And we see a lot of cases of elder abuse, you know, and we don't want that to happen. And that's why we are here. We are here to let you know, family caregivers out there who are listening, that you don't have to do it alone, that we are here to help, that we understand how challenging it is. So let us help you. Let us alleviate some of that stress and give you a better understanding of why she's repeating herself over and over. Hey, it's the dementia. This is what it looks like. This is how it manifests itself. And now that you know that, you can manage those behaviors and therefore lessen the risk of lashing out or, you know, engaging in some abusive or hostile behaviors with the care receiver. So this is why we wanted to bring in the DA. This is why we wanted to have this conversation, because we understand it is a challenge. Now, COVID has added an additional level of stress. I know right now that a lot of caregivers are telling us, you know, you used to talk about going out to the movies and going out to a park and, you know, engaging with friends and family. And we can't do that anymore. So how am I going to get my respite? How am I going to get my breath, my, you know, my break? And so I understand, you know, it's not easy. And so we have to find other ways to do that. And we've actually been having a lot of different conversations with different groups in the community. So I really encourage you to check those out, because it is important that you find other ways. Right now we have to be flexible. That is kind of the key, the name of the game, being flexible with what we have and the challenges that we're all facing. We want to make sure that you know that some of the services that are available to you from Southern Caregiver Resource Center are free. We have counseling services, we have support groups in English and Spanish throughout the county. We have classes, psychoeducational classes, that help you understand the disease and help you maneuver some of those behaviors and how to approach them. And then everything we do is about self-care. Especially right now, we know that self-care is something we all have to do because we're stressed. This pandemic is anxiety producing, you know, we need to have an outlet. And so whether that is crafting or reading a book or going out for a walk or jogging, whatever it is, make sure that you incorporate it every day into your routine. You need to take a break for yourself. So the other thing that I want to make sure is that you know that for a while now, we've been creating an extensive online library of resources for you. And they include live stream classes. And those are different topics, and you can see the library, and they're usually about 30 minutes to an hour. We also have podcasts where we bring in guests and we really talk about those difficult conversations that everybody thinks about but nobody wants to discuss. We also have 1-minute tip videos. If you tell me, Martha, I have no time to watch your classes, there's no way I can give you an hour, but if you have a minute, especially as you're waiting for a doctor's appointment or in line to go grocery shopping, watch a video of ours. It's only a minute, and you're going to learn tips on how to better manage what is happening at home with your care receiver. And then, of course, you know, we want to make sure that you are able to watch some of these webinars, some of these conferences and workshops that we have online. We've actually done some in the past, person to person, and recorded those so you can see what we've been discussing. But I know that for a lot of caregivers out there, this is a very, very challenging time. However, I remember when I was a family caregiver and I was caring for my aunt, that I found myself trying really hard to prevent becoming a victim of scams. I actually, and we can talk about them today, remember several scams that had I not been there with my aunt to, be involved, she probably would have been victimized and maybe lost some of the money or lost some of the programs that she had already been enrolled in. So this is why I tell you, you will be surprised on how much San Diego County has experienced in terms of scams, especially elder-related scams. So at this time, what I want to do is I want to introduce our guest, and I want to have them talk to you more about how to prevent these scams, where to go for help, and really what to look out for so that you don't become a victim, but also how you help the person that you are caring for not become victimized as well. So I'm so honored and I'm so glad that we have our San Diego County District Attorney, Stephan, with us today. And I'm going to read a little bit of an intro to give you an idea of her background. She has devoted her life to protecting children and families, providing justice to the most vulnerable, and is a national leader in the fight against human trafficking and sexual exploitation. Summer is focused on advancing public safety through fair and equal justice, bringing solutions to complex issues with a unique data-driven, common sense approach that works to address the root causes of certain crimes driven by mental illness and addiction. As district attorney, she leads the second largest DA's office in California, managing a professional staff of 1,000 employees, serving as a people's prosecutor for San Diego County, and its more than 3 million citizens. Summer leverages her extensive courtroom management and leadership experience to set clear public safety priorities in collaboration with law enforcement and the community, keeping San Diego County one of the safest urban regions in the United States. DA Stephan holds leadership positions in public safety on the national, state, and local levels, which includes serving as Vice President of the National District Attorney Association, co-chair of the Women Judges Human Trafficking Committee, and of course is available to talk to us today about our how we can better help family caregivers. So thank you so much to our DA, Stephan, and now I turn it over to her. And I know she also has her staff member, Scott Pirrello, who is also going to talk to us a little bit more about how to stay safe in San Diego County. So thank you and welcome, both of you.
Thank you so much. And it's great to see Scott too. My team is spread out everywhere and they're busy, so sometimes I don't see them. Let me adjust this a little bit. Great. Martha, it's really great to be with you, and I was looking forward to this program because of all of the great things that the Southern Caregiver Resource Center does. We all need help, and caregivers need that support and help, and we hear that. I hear that when I'm out in the community, that people just need someone to call because there's so much pressure on caregivers. They want to be good daughters, good granddaughters, and children, but then they have all of the normal life responsibilities. And I see that in my own staff of 1,000. Many of them are working a job, but also caring for someone with high needs and someone who's older and has a lot of health issues and other issues. And we try to do our best here to support them, because after all, You know, there's nothing more important that will allow us to be judged as a society than caring for our most vulnerable, our disabled, our elderly, and our children. And that's why those are clear priorities for the district attorney's office. One of the, so I want to thank you for having me, and it's been a pleasure, and I've been looking forward to it. And I see that a lot of people have joined us, and thank you for joining us, because I'm a big believer that public safety is a shared responsibility, and the more that we share about prevention and making sure that someone doesn't become a victim, the better off we are, because when we come in afterwards to clean up the mess and to prosecute, that means the harm has already been done, that someone has lost life savings, they feel terrible, they feel ashamed, they feel like they've been scammed, they've been had. If we could have prevented that through education and through awareness, then we want to do that. And that's one of our missions in the DA's office, is the 3 Ps, the prevention of harm in the first place, the ethical prosecution of crime, holding people accountable who harm our elderly, and then also the protection of victims when they become victims. And we have a whole division that does that. I'm so proud to be joined by Scott Pirrello. He leads our elder abuse unit, and he's, you know, I get a lot of notes about him, and it just makes me feel like I'm kind of like the mother to 1,000 employees, and I feel that kind of warm pride when I get those, because I know that we are then fulfilling and serving our mission. In this time, I want to talk a little bit about how law enforcement handles all the different elder crimes, but focus on scams and bring a new perspective as to what's happening in the time of COVID. And the DA's office is in a unique position because we are the one link with all law enforcement. In the San Diego County region, we have 9 police chiefs, a sheriff, multiple sheriff substations, and they're all doing their part, but we are the connector as the DA's office. All of the cases and crime trends will flow through our office. So we're in a position to spot what is going on, where are the criminal trends going, and where is the prevention piece that can be brought in to stop a trend from continuing and victimizing more and more and more. With that, one of the priorities that we set early on was the protection of elders, and we were able to bring together an Elder Protection Council, which you're a part of, in order to look at these trends and look at prevention. One of the things that really breaks my heart in the time of COVID, in addition to all of the deaths and the deaths that have stricken our elderly more than any other, and many in their care facilities, which is absolutely heartbreaking, is that there is a feeling almost like, because there are stay-at-home orders and because there are shutdowns, there's almost a feeling like you can't call law enforcement, that we're not here, we're not available. And that is the farthest thing from the truth. We have found a way to operate because we have an essential mission of serving and protecting and keeping our community safe. And so we found a way, even behind the closed doors of a courtroom, we've established video conferencing and remote hearings so that we can meet all our deadlines and make sure that we keep the community safe. The police is still responding, the sheriff, we're all working, and we are continuing our operations every day, although it might look slightly different. While we're doing all of this, the scammers and the fraudsters are also working. And in fact, they are working double time because they realize that people are spending more time on their social media, on their tablets, on their computers, on their phones. So they're utilizing this time that we are all using all that technology to also use technology to defraud and scam. The ingenuity, if they would only use it to actually do an honest day's worth of work, would be tremendous. But this is not what their end game is. It's about taking somebody else's hard-earned money, and elders and seniors and busy people, including caregivers who are running in this direction, and next, no one is immune, are perfect targets. So one thing that shows you the level of depravity is using the COVID time to send messages saying that you are a person that has been identified as having been in close proximity to someone who had COVID. And therefore, you should click on this link so that we can get you where you need to go to get tested and to get help. On its face, it's really just appears so legitimate, and in this time you wouldn't even think of questioning. No one would think that someone would stoop so low as to use a time of fear and a time that there's so much uncertainty against people. But the number one rule that I'm going to keep repeating throughout this presentation is never click on an unsolicited email that you get. Do not click on anything. Instead, go to the official website that they're representing themselves to be. Are they county health? Is that what they're representing themselves to be? Or Scripps Hospital? Or contact that official body that they're representing themselves to be to find out if in fact there's any truth of this, but never click on anything. This goes for the caregivers as well as the person you're taking care of. Along those lines of COVID, people are economically anxious about their incentive checks or whether they're going to get their Social Security. Rumors abound about how much expenditure has gone on. So maybe your Medicare, Medi-Cal, your Social Security might be affected. So again, you'll get phone calls representing to be the IRS, to be Social Security. And the goal there is to get your information, to verify your information. And they've gotten really good at it. The numbers that they use, the emails they use, they used to be so easily detectable as fraud. But now they really look like the real thing. And the goal is to get you to bite, to respond, to verify, because you're waiting for your Social Security. So to verify some information about yourself that they can then use to get a new credit card in your name and to get your money and to go ahead and scam you. A lot of scams are based on some upfront payment that you can make. You just have to make this small payment so that you can prevent a bigger harm, like your bank account being closed or your bill not being paid. And because there's so much uncertainty in this time of COVID and the days seem to run together, people believe more so that maybe they missed a bill, they missed a payment. We had actually in San Diego County very smart companies, companies, not just regular people that are really at the cutting edge of research, get scammed because systems are failing. So they're asked to wire a bill or else their account is going to be shut because something happened because of COVID, and the companies will do that. They will bite on that. Some of the normal scams that we've heard of, the grandmother scams, where usually it's about your grandchild being in jail and you have to pay some amount of money to get your grandchild out of jail. And especially with some dementia and failing memories and, you know, not really being certain about how your grandchild's, you know, your grandchild's name, or whether they actually took a trip, that now that's transformed to your grandchild needs some money because they have COVID and they're in a hospital, they're in a coma, they're intubated, they can't talk to you, but they need a payment immediately so you can help them. Again, these are all scams. No one is going to call you from a hospital and demand an advance payment or anything like that. One law that I'm very excited about extends, that's going through right now in our state assembly, extends the time for anyone over 65 to cancel a contract that they've been pressured into from 3 to 5 days, to allow seniors more time to consult if they got a pressure job and they ended up signing something for a new policy or something that they regret. It gives them more time than just a weekend to go and handle that. That's AB 2471. So any letters of support, talk to your assembly members, your Senate members about supporting that bill. That's a step in the right direction. One of the other things that are happening is they're really, really smart. I mean, I just can't tell you these. Even you would think that you know, these romance scams don't exist, but romance is something that's needed at any age. People are looking for love, you know, and you know, there's different websites that help seniors connect, you know, to have a companionship, to have a conversation. And this one is really well done. You know, the sweetheart scams, as we call them, the romance scams, they're really getting better and better at it. You would have to really be very sophisticated to be able to figure it out. You know, people, especially during COVID, are not meeting up for a date in person. So it's a great opportunity to build a relationship, to build connections. You know, we know even if we don't have any issues with dementia or anything else, that the more you communicate with someone, you know, look at how Facebook is being represented. They represent people talking to you as friends. Now, these people may not be friends, but they're identified as friends. And the more time that you get a pat on the back and you're told that you said something really smart and that you look great and someone cares about you, the more this person feels like they are a true friend. They're in your circle. So imagine now somebody that is feeling more lonely, they're becoming more isolated, they're aging, their health is not all there, and now someone is giving them that attention. The social connections are so good for people, but they're also an opportunity for those who want to perpetrate fraud. So the sweetheart scams, people have lost money at the tune of hundreds of thousands of dollars. You know, Match.com or SilverSingles.com. We have a case in San Diego where someone lost almost $1 million, $850,000, that I'm sure they wanted to leave, to live a good life and to leave for their families. So what is difficult about these, although we have the amazing prosecutors like Scott, a lot of them originate out of country. They originate in a foreign jurisdiction where we don't have even extradition agreements. So we are not able to bring accountability. Therefore, prevention is the key. You know, talk to your seniors as to who's talking to them online and what is happening. Talk about the stories that you're hearing, because then it might bring up conversation. Remember that people never want to feel like they were not, that they've been had, that they weren't smart enough to detect the scam. So you don't want to have judgment about it. You want to address it as if every one of us is capable, is vulnerable to these scammers that are so well organized and methodical in their deception. You want to open the door to the conversation that this is something that anyone can be susceptible to, so that they can open up, because after all, only 1 in 25 cases ever get reported. That's why the statistics show somewhere between 3 billion to 30 billion is the loss. And the reason we have such a big range is because we know how many are unreported, because people don't want to feel like they've been had. They feel shame. They want to hide it from their family. And they think they're the only ones that fell for it. So having non-judgmental conversations about how all of us could be susceptible to this is very, very important. And I know we're talking about scams today, and that's very, very important, but don't forget physical abuse as well, and neglect, opening the door to those conversations. If a senior is in a care center and you can't see them because of COVID, you must insist on putting eyes on them by using the technology of FaceTime or anything, so that you can actually see them, because you will be able to detect things about your loved ones that others may not detect. And, you know, looking for signs of neglect, signs of abuse, whether it's bruising, whether it's a depression, a lack of communication, all those things. So let's not completely forget, let's address also neglect and physical abuse and being mindful of that. So kind of, I want to leave time for questions, but one of the things I want to make sure that you are aware of, you know, the census going on, the IRS, the Social Security, charities that are trying to get people's money. All of those things, you have to just hang up the phone, don't click on anything on your computer, and then take a deep breath. The answer is no, thank you, not now, hang up, and then don't click, then research it. Talk with your loved ones about it. There's time. The only people that give you that feeling of urgency, like it must be done now, are usually fraudsters, because nothing must be done right this minute. You can take your time, you can take a deep breath, research it, look on SanDiegoDA.com, where we have a ton of resources about elder abuse. Call Adult Protective Services, look at the FTC website that has what are the most common scams right now, and then make a decision. Encourage your senior to open the door for them to tell you that they messed up, by saying how all of us are capable of messing up, so that they don't feel like they are losing their mind even more than the way they may be feeling. Give them that honor and dignity to know that we all can make these mistakes. So I'm going to stop now for questions, and I hope I gave you some concrete examples and some tips on what to do.
Thank you so much for participating and really for everything that you shared with us. I was taking notes because I often come across caregivers who experience similar situations. Obviously, now they're a little different and more creative because of COVID. Um, I also wanted to see if maybe we can have Scott. I don't know if you want to add anything else to the conversation. Scott is our deputy district attorney. I know we participated at a couple of conferences and I've heard you speak and very passionate about helping seniors and staving off, elder abuse. And I know that this is an area that the district attorney's office is really serious about combating. And I really appreciate that because again, having been a caregiver, but in also talking to caregivers, it's good to know that we have someone out there who's doing the hard, dirty work for all of us so that we don't become victims of these scams. So before I open it up to questions, I wanted to see if there's anything else that you wanted to add to the conversation.
Scott, maybe you can describe too, because I didn't describe how the romance scam goes, how they start off.
Yeah, you can hear me okay, right?
Yes.
First things first. Yes, the romance scams, and thank you, Martha. It's great participating in several of these town halls, and thank you, Summer. It's really my pleasure to work in the county and for a boss like Summer who prioritizes elder abuse because it forces me out into the community. And I think one of the most important messages for your organization, Martha, is when I first started this years ago, and Summer is pushing us out into the community, I was talking a lot directly to elders, and that's wonderful. And it's great to be out there in nursing homes and spending time with them. But somewhere along the line, I started to think that I was missing the mark because there's a more important audience for this message, and it is the caregivers. It's for the children. It's for the grandchildren. It's for anyone who is going into the house of their elderly parent, grandparent, aunt, or uncle, and looking around for some red flags and warning signs, such as, a bunch of gift cards sitting on the table, or, a bunch of mail stacked up from, unknown origins or financial statements. So it's so important for the rest of us. We're the ones that need to do the prevention piece, and it's to intervene in all of the people that we love and in their lives and to talk about these things. And the romance scam that Summer asked me about is really such an important one because when I go to the nursing homes and give the talk, everyone starts giggling as soon as I say it because it sounds so outrageous, right? For someone who is maybe 80, even 90 years old. But I read the police reports, and these are the most heartbreaking. There is a huge financial devastating loss. Summer mentioned there's a case we're looking into right now with $850,000 in losses, but mentally, it is so devastating, and often the victim of this crime is so angry at our office or at the detective who's telling them that this is a scam because they're still waiting for their knight in shining armor, and I'll explain a little bit how it works. Often at the encouragement of their children, someone will say, hey, Mom, Dad's been gone for 20 years. Why don't you go on Match.com? You don't need an actual boyfriend, but maybe a companion would be nice. And within a day of them posting a profile on one of these, whether it's Facebook or Match.com or Silver Singles, there's a few of them for people over 55. Within a day, they get contacted by either a suave international businessman or woman or a member of the military. And there's photographs of this strikingly handsome or beautiful person. And the story is typical that the international businessman is in Malaysia because he's building a skyscraper there. But after he's done building the skyscraper, he's going to move back to his mansion in Rancho Santa Fe. And so there's a real romance that develops. And we're talking about hours being spent talking on the phone, emailing, love letters. We had one clever suspect from Nigeria who was sending the victim checks for $1 million. And imagine this. So the victim is receiving checks, but he's telling her, don't cash it now, my darling. you wait until I get there and we'll cash it together. We're going to buy and build our dream house together. So it usually goes on for months. That's how they get so much money. The victim loses track. And what happens is on the eve of this wonderful reunion where this dream man or woman is going to fly back to San Diego to be with our victim, they get held up in customs and they need money. They need money to pay off the customs officials in this other country. And it goes very quickly because our victim has already picked out the dress that she's going to wear to the airport, and she's got her whole life, future life plan. She will go from sending a few $1,000s to reverse mortgaging her house within a very short period of time in order to get this person here. So it's just, it upsets me just repeating this because this isn't just one case. This is happening to thousands of people who are seeking companionship, and it's devastating to them. And there's actually research now that supports the notion that financial elder abuse is actually the next wave of a public health crisis because, Martha, from working with elders for your career, this hastens their life. It shortens their life expectancy to go through something like this. So, if you're at the Thanksgiving table with your family, it shouldn't be embarrassing to throw a question out there like that. Hey, is anyone on Match.com? Is anyone being contacted? The other just big warning signs that I always want to talk about, there's 3 main ways that the suspects are getting money from our elders. The first is gift cards. They're sending our victims to big box retailers to buy huge denomination gift cards. And then there's a little PIN number on the back that if they give the scammer can pull the money off the card right away. The other way that they're starting to use is to use the latest technology. They're using Bitcoin or cryptocurrency. And someone might say, oh, my grandmother can never figure out that. There's a way that a scammer can talk someone through setting up an account on their laptop in a very short period of time, and then using their online banking to get money. And it's interesting, in COVID, the elders are restricted from getting, say, to Home Depot or to Walmart to buy gift cards. And so we're seeing an uptick in the third way that they're getting money, which is good old-fashioned sending significant amount of cash using FedEx or UPS. And so if anyone is ever asked to pay for anything in any of these ways, that's a signal right then and there to just eliminate, to close down that contact with whoever they're talking to, and time to tell a loved one, because it's 100% a scam if you're having to pay for anything, whether it's construction on your house or you think your grandchild's in trouble or that you owe the government money. These 3 ways are 100% certain to be a scam.
It's so devastating, to hear these stories. And I know that's what is happening, which is so unfortunate because there's this trust. There's this human factor, and these people are preying on that. And that's why we always want to make sure that caregivers know the resources that are out there, where to call if you suspect that your parent, your care receiver, is becoming a victim of these scams that you've mentioned, or even any others that you didn't mention, but they just look weird, to let you know. So maybe at this time, if either of you could just maybe mention your website, mention a phone number before we get into the Q&A. I think it would be very important for caregivers who are listening to jot this information.
So this is very important, and it's our partner agency that we couldn't do our jobs without. It's Adult Protective Services, and their phone number is 1-800-339-4661. And what makes them especially available to everyone is you don't have to see a crime being committed in progress. It's not a 911 call. You can call just if you suspect something. If you're concerned about your neighbor down the street, you could be anonymous, but someone from Adult Protective Services will follow up with them to make sure that they're safe. I also just saw one question pop up on the line saying, what are resources that teach internet literacy and cybersecurity? Summer mentioned one earlier. The FTC has amazing resources on their website. It's the Federal Trade Commission, ftc.gov. And there are so many articles and information there. Or if you want to Google the Department of Justice in Washington, D.C., they have a whole elder justice initiative. You could just Google that and you'll see there's videos, there's articles, there's just a real depth of information out there from our federal partners.
Wonderful. And again, these are all available and free to everyone. I know that if any of the caregivers out there want to contact us as well, we can put you in contact with local resources. So our website is scrc.care, and our number is 858 number is 858-268-4432. So you can give us a call, you can send us an email. We are also on social media, so if anyone wants to send us a message and we can connect that way, just again, employ these prevention methods so that you don't become a victim of some of these crimes. So now we have some questions, if I may kind of switch a little bit. We have a lot of questions, so I'm going to try to pick out some, and either of you could answer. It's obviously a topic that's very in people's minds. So of course, this is related to caregivers and the people that they care for. And this is interesting. I'm picking this one out because I actually can relate to this one. It says, how do you convince an elder adult not to carry large amounts of cash with them or not to have them in the house? And the reason why I say relate to this is because when I was caring for my great aunt, I became involved in making all her payments and her rent and everything, right? And make sure that everything was taken care of. But I remember one time I got an alert from the bank that said that a large amount of money was withdrawn. And so I thought, you know, how was this possible? My aunt doesn't know how to use the ATM, right? So what she had done, and it wasn't so much a scam, but it was just her level of thinking at the time. Again, she had dementia, and that's why I was her power of attorney and the person who was in charge of all these transactions. But she had withdrawn all the money because she had heard from someone that the best and most secure way to keep your money was under your mattress, because then no one can steal it from the banks and you could always have it, you could always count it. And so it took me a while to realize that that was her thinking. And I actually remember cleaning her bedroom and finding wads of cash under her bed. And I said, we got to put this in the bank. Somebody can break in and steal everything, or you might forget. And so as a caregiver, you know, I had to be aware of these things. So I don't know what you suggest.
Well,
for caregivers.
if I could jump in, Summer, because we had a great case that our office took the lead on in partnership with Chula Vista PD. It was called the Latin Lotto scam. And what it highlights is, as Summer mentioned before, we're only hearing about 1 in 25 cases. That's what all the research suggests. But especially here in San Diego, another heartbreaking fact is our immigrant communities that are so special and part of the fabric of San Diego, whether it's from Mexico or some of the Somalian and African countries that have wonderful communities here. Think about the amount of abuse that's happening, and under the threat of fear of immigration authorities, these victims are never going to report this case. And we had a ring of suspects who were operating down in the South Bay at primarily Hispanic grocery stores and supermarkets, and approaching elderly females and telling them, you know, basically the ruse was that the person was crying. It was an elderly female suspect crying and saying, I just won this lotto ticket, but I'm not a citizen here. I'm afraid I'm going to get deported. And they bait the, you know, Good Samaritan victim to contribute money to this fund so that they can go and cash in this lottery ticket. And what we learned in that case, because we had about 6 or 7 victims in the county, is that a lot of these elderly women had thousands of dollars sitting in their houses for the same reason. They were afraid of the banking system or not trusting. And so that's a real way that these scammers can take advantage, knowing that there's cash lying around. And so these are difficult conversations. It's akin to telling your parent that you don't want them to have a driver's license anymore. So, the second that you're noticing red flags from your loved ones that they're starting to decline, it's when you have to start having these difficult conversations and getting the cash out of their hands. So there's no easy answer.
It's so true. And along the lines of that is scamming people from their homes. I have a question here that says, how do you prevent older homeowners from losing their home to a scam? What do you suggest?
I mean, definitely that's something that we see in real estate fraud, is because they know they bought their house for a certain amount. So any amount that's offered to them that is a complete rip sounds like it's a good deal, but in fact they're kind of losing all of the equity in their house. Also being pressured to take a second mortgage on their house to get a different house or to get a place that gives them more benefits as a senior, which is an absolute scam. We've had several cases like that where now they no longer really own their home, but the thing that was offered to them, the second beautiful home for them to retire in, is a fiction and not true. So that's one of the reasons we have this kind of breaking the contract in 5 days rather than 3. But it's always about talking to your loved one, about discussing anything before they sign and before they give money, but also empowering them, making them feel like that this is happening to all of us. So anytime somebody's trying to buy your home or trying to get you to get a second mortgage, to discuss it with you, if you're the person that they trust.
Now, I have here one that's very specific to COVID. And, it's, again, I talked earlier about the caregiver who's working and therefore, has to maybe go outside the home and then come back. And so this one says, I care for my 92-year-old father. He is independent. However, he's been getting a lot of calls about the COVID-19 cure. And this person says, I know it's a red flag, but sometimes he's home and I'm not there. And so he's picking up the phone and becoming a part of these conversations. What can I do about that? Because this person specifically says, without getting him upset.
No, these are all real questions clearly people are living this.
Yes.
But again, I really believe it's about knowledge and arming people with having these conversations. That the fact is that empower them to look at the fact that there is no cure, that the CDC hasn't announced a cure. Have them share with them, look at the website with them for them to feel respected and empowered. Look, there is no cure, or else it would be right here. Why don't we call our county health department and ask about this? And you can ask together about it. But the bottom line is just have them never give out personal information. If they want to, and have them not commit to giving money to anything, to at least promise you that. And then you might not be able to stop them from picking up the phone, but have them promise you not to give money or give out personal information.
It's certainly a very difficult thing. Either way you slice it, because as caregivers, we want to protect our care receivers as much as possible, but sometimes it's not possible. And so we really appreciate you being out there, being those external factors who are there protecting the elders and protecting families. So as I wrap up, I just want to see if there's anything else you want to say, any last words, any last statements for our audience.
Well, Martha, we're honored to be here. And as you can see, Scott represents our elder abuse unit, and we are here for you. We have a victim services division. If you're become a victim of a crime, we'll guide you through the process. We will take care of you in a way that meets all your needs. So we just want to have, we want to be your people's prosecutor. We're here for you. And the websites that we gave you are great, but if you forget about them, you can go to SanDiegoDA.com, look at the Elder Abuse tab, and there's everything downloads there as to where to go to get help, whether it's APS or the FTC website. So it's kind of a one place. If you feel like reading about the latest crime trends and what we're doing, we have a newsletter that is by email that's really like an up-to-date crime story of what's happening. So you can sign up for that on our website also and stay in touch with us. And if there are questions that aren't unanswered, feel free to email them to Scott, and we will try to get you an answer to them because we appreciate everybody's time here today.
We will certainly do that. And again, thank you so much for taking time out of your busy schedules. I know that it's not easy to juggle all of courtroom and all of the cases that you're doing. So thank you so much. We've been wanting to do this for a while, and we really appreciate your insight and your tips. Thank you all who signed up and were listening. We're going to have this available, recording available, so that in case you want to share with others or push it to other individuals who might be interested in listening. And of course, I welcome the opportunity to partner with you again, whether it's this format or in person or whatever else available, so that we can bring more resources to the community. Thank you so much to you, Scott Pirrello, and to our DA, Summer Steffens. Thank you so much. And thank you all from SCRC. We'll see you next time.
Thank you. Bye.
Bye.